This episode is brought to you by Healthlink Advisors, value, insights, and solutions, expert consultants serving the healthcare industry. Check them out at thisweekhealth.com/healthlinkadvisors. Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview. All right, here we are, another interview in action. And today I'm joined by Lindsey Jarrell with Healthlink Advisors. Lindsey, welcome to the show.
Yeah, thanks. Great to be here.
Well, I'm looking forward to this conversation. You guys are working with a lot of health systems today on just a significant amount of challenges they are facing. Give us an idea of some of the things that you guys are focusing on for 2025.
Yeah, at high level, I'll start there, kind of the who we are, right? Look, we work in provider organizations across the country. We're really focused in that leveraging technology and improving process. We are very kind of mission minded. Like, we're in it for the patients, we're in it for the community, we're in it for the team members of the healthcare system. I got into healthcare for very personal reasons. So we bring kind of that passion in our culture to wanting to improve healthcare and really focus in on that area. So we do the traditional advisory consulting work, strategic planning and interim leadership, a lot of program management. But when we think about 25 and what we learned in 24, our focus is going to be in a few areas. Not that we're not going to do those other things. We'll always continue to do what we do well. We see enterprise imaging as a big growth area, something that we had a lot of work in the last 2 years. We think there's a lot more work there, both in efficiency and cost and replatforming. Getting the most out of your Epic investment, totally. We're going to continue to spend time there. We do a lot of upfront planning. We used to get asked the question, I want a new EHR, help me select the right EHR. Now we get called and the question we get is, help me figure out if I can afford Epic. When can I get it approved? How much is it going to cost over 10 years? And so we do a lot of that work, but getting the most out of your Epic investment, and then business continuity. So cyber attacks, ransomware, down 6-8 week downtimes. There is a renewed focus on, and I can't help but smile a little bit, right, on back to how do we operate at downtimes. Well, we've been so stable across the industry for so long, we've lost our way with that. So true business and clinically led business continuity planning, we've got to teach ourselves how to do that in this industry again. And so we're doing a lot of work in that area. So imaging, business continuity, getting the most out of your Epic investment, I think those are 3 big focus areas for us next year.
I'm going to come back to those 3. Give me the origin story for Healthlink Advisors then.
I've been in and out of the provider side a couple of times. And before co-founding Healthlink Advisors with Chris Jenkins, let's see, we're coming up on 9 years, which seems hard to believe. I was a partner at PricewaterhouseCoopers, running the hospital revenue cycle business and a big piece of the HIT business. And I spent about 5 years at PwC, learned a ton. And one of the things I learned, though, was that kind of consulting model really I wasn't wired for it. I more like the boutique, get really close to the clients. Sometimes we give away work, sometimes we redo work, right? You want to be so close to a client that you do those things without a second thought, because life happens, right? And while I'm very thankful in my time at PwC, I left there and literally started Healthlink Advisors with no clients and no paycheck. And Chris and I were looking at each other at times thinking we were crazy, but it worked, right? It totally worked. And we've grown it organically. We have no outside money. We have no debt. We've got a team of 100 folks who are just passionate about doing the right thing. And that's it. We wake up every day with a little bit of kick in our step and go to work because we love what we do. And that's a really good fit for us.
It's a relationship business. I talk to people about, they get offended from time to time. I'll use the term vendor. And they'll say, we're not vendors, we're partners. I'm like, no. Partners are earned. Vendor sells stuff. Partners, that's an earned position. And that's the relationship. It's somebody, when I have a problem, I'll pick up the phone and call and say, hey, I need somebody to work through this with it. I assume you get a fair number of those kinds of phone calls.
We track everything kind of meticulously. It's the way we're wired. When we look over the last 2 years and see where we get a new client, 95% of every new client we come to us is a client referral. We don't get it through the website. We don't get it through ads. We view conferences and things we do like that as branding campaigns to kind of stay out in front of people so they can read our name. But we get business when one CIO calls another and says, you need to work with these folks.
Yeah.
And that's a beautiful thing because that's relationship centered, right? Just to your point. So.
All right. So 3 things: imaging, get the most out of your EHR investment, and business continuity. We're going to start with the third, business continuity. This has been an interesting year. So we had Ascension this year. We had Change Healthcare this year. We had CrowdStrike this year. I think Scripps was one of the earliest large systems that took an extended outage, but clearly not the last one. But there's been a lot of this. It's interesting. Has this finally gotten I don't have to explain it to my board anymore. They've read enough articles. They understand the ramifications. And it's just a matter of, okay, how do we approach this prudently and effectively to make sure that we are solving the right problem?
I think so. I can tell you we're working at 2 health systems right now doing this. Both are bigger, much bigger than 15 hospitals. In that case, both of the top execs knew a top exec at Ascension and had a conversation, came away from that conversation and was scared to death and said, we've got to do something. In other places, the board is more involved. It says, what are you doing about business continuity? So it's definitely changed the conversation at a lot of these places. And the justification, while it is patient-centered, COVID, interestingly enough, taught health system revenue streams enough to where they now believe the business case for ransomware. What do I mean by that? When you cancel electives, profitable revenue stops.
Right.
And you have to have profitable revenue to make up for Medicare, right? Or to make up for Medicaid. And so when you get hit with ransomware and you start canceling electives across the health system, that can be $5 or $10 million a day in revenue. That pays for your consulting engagement right there. And that's per day. So per weekday, so it's really changed the conversation. And we believe there's a lot of good opportunity there to really make it business and clinically led.
I was in Nashville when they announced the Ascension, when that was going down. And I was sitting with somebody and they said, buy HCA stock. And I was like, why? They're like, because all those Ascension hospitals overlap with HCA and they're all on diversion and it's all going to HCA. And they were right. I mean, I didn't buy the stock, but they were right. There was an awful lot of revenue that just absolutely went outside of that health system for that period of time. Let's talk about maximizing the Epic investment or the EHR investment in general. This is a significant investment. And I think even Epic more and more is eyeing how do we optimize this significant investment and make it more efficient. What are some of the ways that people are identifying and moving the needle in terms of really leveraging that investment for a return, but also for better quality, better results just across the board?
Yeah, a couple of things come to mind that we see, and that's once you have Epic installed, and I'll just talk about Epic because that's where we see the opportunity, is an Epic first mentality. Now that can mean sacrifices. And really what I'm saying there is if you're going to expand or you need a new system or you need a department covered, the first question is, can Epic do that for me? Yep. And while I realize sometimes that gets kind of the hair on the back of our neck stood up, because I've sat in the CIO role and I'm like, we can't give the same business to the same people all the time. That's a monopoly, right? I would think these things in my head when I would see that. But the truth is, it works better and it's integrated and we can report better on it. Now, it might not have the latest and greatest functionality, but the story goes, and I believe it because I've seen it, if Epic chooses to do it, they're going to do a good job at it. And so I think an Epic first mentality is one. And the other thing I'll mention is putting the resources on the team doesn't necessarily mean IT to understand what Epic's capable of and ensure everyone is using the platform. That's no different than Workday or ServiceNow. I can't tell you how many ServiceNow customers I've been in that are using a tenth of what ServiceNow can do. And it's a very expensive application. So the same thing goes with Epic, right? And so that means what clinical champions do you have? What physician champions? What revenue cycle champions? Who's really getting to know Epic and staying ahead of what they're developing? Epic has this concept of, a BFF, a best friend forever for your account. We talk to clients and say, you really need that inside your org as well. You need a revenue cycle BFF and a clinical BFF and an IT BFF. And those folks really have to stay ahead of what's coming out. So Epic's in a very unique position. I don't know that we've ever seen this in healthcare IT today. And I think it's going to continue strong for the foreseeable future. So
yeah, we do our 229 events, and I will open it up. One of the first questions I'll ask is, all right, let's just get this out of the way. Identify your EHR. How many people are on Epic? If there's 15 people in the room, it's 12 at a minimum. It's 12. Even the smaller systems have headed in that direction. It's really kind of interesting. I want to touch on the last topic, and that is imaging. Imaging is one of those areas that I don't want to say has been neglected. There's been an awful lot of money spent in that area, but it seems to be spent in ways that are very non-integrated in terms of its thought. It's like they treated them as all these different businesses. Yeah. And is that changing a little bit? Are we starting to think about it, imaging as a thing within health systems instead of each individual department doing their own thing?
Yeah, I would say based on folks we're talking to and what we're seeing in the market, it's changing, right? People's eyes are getting open to how much layered technology there is. And that's at the app level, but it's also at the tech level. It's like how many one-off technical design and architecture decisions did we make inside our walls to get this one radiology workstation to work fast enough for the radiologist, right? So it's the tech stack, it's the app level, it's the VNAs, it's the health system that has 4 or plus PACS systems due to acquisitions. Like you don't go acquire a hospital and the first thing you think about is how do I get them off their PACS system? You just let it ride out, right? Well, now all of that is kind of coming full circle and they're looking at it and saying, how much am I paying in maintenance agreements? How much is it costing me to not be completely flexible with all of this imaging data, given where healthcare is going? So we're doing a lot of that assessment work and a lot of the remediation work. And then final point is there are now vendors who can really look at the platform across cardiology and mammo and all the internal and outpatient and really serve a broad health system capability. So I think a lot of things are happening in the market that's causing people to take a hard look at it.
Plus digital pathology as well. And then you have all the ologies. But one of the things that seems to be driving this to me is this applying AI to the imaging space. So we all know it's one of the areas where the data is very clean. It's an image, right? It's a very clean data set, more so than a lot of the other data sets that we use. And it's been proven that AI can be a really great assistant. But then you sit there and you go, all right, we're going to apply this AI. And you realize, we've got to apply this to 36 different systems, and you got to integrate it into 36 different systems. And so bringing some of these advanced technologies to bear on a non-integrated platform is quite challenging.
Yeah, and the other thing I'll add to that excellent point is that it's also going to help with the radiologist shortage, right? We are talking to clients who literally cannot get coverage. And so you're having Nighthawks, the old Nighthawk term, right? There's a lot of companies out there beyond just that. You're doing offshore reads. You're trying to cover this in any way you can because the medical system's simply not producing enough radiologists. And that job is a tough job these days, right? It is a highly productivity measured go produce, right? All day long job for docs. It can be not very satisfying. So a lot of folks are not going into it. So I think AI can help there, as can a single platform, because it's better for people to get into the systems that you need coverage on. So it's just a lot of different dynamics going on. It's causing people to look at this. Some of those AI systems you're mentioning, the incidental findings, as the AI looks at an image, when the physician's focused in on one part, the incidental findings that come up as AI reads that image, if the payer contract is right, it can also produce some nice income for health systems just with the additional findings. So that's just one way AI plays into it. There's a lot of good opportunity there.
Well, Lindsey, it sounds like 25 is stacking up to be a fairly busy year in healthcare.
I think so. We're really looking forward to it. We've been blessed with a great year and great clients and fantastic team members. And so I think we're just going to stay really busy in 25. We all are.
Well, fantastic. Hey, I want to thank you. Thank you for your time. And I look forward to catching up with you in the new year.
Yeah, always great to talk. Thanks a bunch.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, that would be great. Thanks for listening. That's all for now.